Advances in scanning technology mean we can detect calcified plaque and even measure it. The calcification test is a quick, non-invasive test for heart disease.
So this is a fairly typical CT scanner that we use. You can see it's open, so patients don't have any claustrophobia. They're kind of outside the environment, in an outside environment at all times. And literally you just lay down on the table. We hook up the EKG monitors to the skin just to keep track of the heartbeat. But there's no needles, no intravenous catheters. And the whole test takes about 5 minutes once the patients are positioned on the table to be done.
Dr. Matt Budoff is a practicing cardiologist, a fellow of the American College of Cardiology and the author of the guidelines on calcification scoring for the American Heart Association.
What we do is we take a series of slices through the heart, kind of slicing the heart like a loaf of bread from the top to the bottom, taking very thin cuts and inspecting that. So here we can see the spine in the back, we can see the breastbone in the front, and then the heart is in the middle, kind of protected. And as we scroll down, we can see this heart, instead of being all gray, has some of these white spots which represent calcification, which is the same density as bone, so it's literally hardening of the arteries. This is a patient. We just took their picture 5 minutes ago. We bring them out here and show them these images, and we can say, these are the plaques building up in your arteries, and even though you feel well, you're starting to get some hardening of the arteries, and it becomes a very impactful message for the patient. Calcium scoring is really just a numerical number of how much plaque. It's a volume of plaque, if you will. It goes from 0 and it goes up. But the score goes into the thousands because you can have a lot of volume of plaque in your coronaries. And the more plaque you have, the more likely you are to suffer a heart attack, stroke, or even die of heart disease.